Greetings, my name is Dr. Lori Ernstberger, and welcome to Behavioral Training Resource Center. Today we're going to explore in a three-part series individuals on the autism spectrum or autism spectrum disorders. I want to first clarify the terminology because a few years back we had separate categories where medical doctors and professionals would diagnose individuals with autism, which was separate from Asperger's syndrome. And there was also other categories like pervasive developmental disorders not otherwise specified. And what's occurred in the last 3 years is those categories are now combined under one umbrella term, and that is ASD, Autism Spectrum Disorders. And so if you see that acronym ASD, we're talking about individuals on the spectrum. It can be from very mild ASD, so almost an invisible disability, you may not recognize some of the characteristics, or very severe ASD, an individual who maybe is nonverbal, who has severe behavior issues, who may also have an intellectual disability, or what we used to refer to as mental retardation. So it is a spectrum, and we have to look at the characteristics of ASD across the spectrum. So let's explore the two main areas of autism spectrum disorders, or the two main characteristics. First of all, number one is an impairment of social communication. And what that means is individuals on the spectrum have difficulty with their social skills, with communicating in larger groups or communicating in social contexts. So they may have difficulty when you're at a party and you have to talk to new people. Now, that doesn't mean they have no social skills, because certainly I know many individuals on the spectrum who have friends, who have a social life, they can go out and they're with other people, but that's going to vary on that spectrum as well. So they may have difficulty picking up on social cues, like when is somebody bored, or when is it time to transition to a new conversation. Those are really tricky and hard to understand. They may also have problems understanding that somebody else has thoughts and feelings and emotions that are not theirs. And that's called theory of mind. And it's understanding social perspectives, that what I think is important, you may not think is important. So all of that social context, understanding those social cues and social perspectives, you can see how it would be really challenging for a person on the spectrum if they're meeting somebody new or if they're in a larger group. So characteristic number one that we see across the spectrum is that social communication impairment. The second area of characteristics for ASD is restricted and repetitive behaviors. Now, what does that mean? It means people on the spectrum tend to be very rigid, sometimes inflexible. They want to do things the same way, or they follow the same pattern. You know, when they get up in the morning and get ready for school or work, when they get ready in the evening to transition to bedtime. So they can be very inflexible. But what we do know is they like routines, so that's a good thing. And we all like routines. When we're in our own comfortable setting, our work setting, our home setting, we feel less stressed. But when we go to someplace new, or we go to an airport and we travel, it can be very stressful. And so what you see is sometimes that anxiety or behaviors as part of that ASD might become more severe. So part of the disability is restricted and repetitiveness. Repetitiveness means they may repeat behaviors, they may repeat phrases. So that's a self-stimulatory behavior. Let me ask you, have you ever talked to yourself? We do that from time to time, especially when we're stressed or anxious. And so you'll see individuals on the spectrum may have some what we call movie scripting, where they're talking to themselves or repeating a movie script. That's part of that rigidity or restrictedness. The restrictedness also comes about when it comes to eating. I know many individuals on the spectrum, and I wrote a book on this topic called Just Take a Bite. where some individuals on the spectrum only eat a handful of foods because it has to be a certain way, a certain food, a very certain texture. Now, that may also be due to sensory issues. Individuals on the spectrum can be hypersensitive or hyposensitive to things like noises and to visual stimuli, to texture, so the feeling of your clothing or how your socks feel on your feet or in your shoes. And so that hyper or hyposensitivity we see often on individuals on the spectrum. So think about all those sensory systems that you have to smell, to sounds, to seeing things. And so that can be overly sensitive to individuals on the spectrum. So there are two main categories when we talk about autism spectrum disorders, or ASD. The first characteristic, an impairment of social communication. And the second is restricted repetitive behaviors. So I hope that helps you understand as we explore in our three-part series on autism spectrum disorders. Now stay tuned for part 2, where we're going to explore tips and strategies. What can you do to help?